Good morning, good afternoon, and good evening, everyone. I'm Professor Suzanne Higgs, and as President of the Danone Institute International, it's a great pleasure that I welcome you all to this award ceremony for the Danone International Prize for Alimentation, or DIPA. So it's an honor to introduce to you Dr. Heather Eicher-Miller, who is the laureate of this third edition of the DIPA. So many congratulations, Heather. We're really looking forward to finding out more about your winning research on improving food security, dietary intake and health through integrated science and engineering approaches.
Thank you so much, Dr. Higgs. And I want to say a few words here. I'm very honored and so grateful for this opportunity to be the third Danone International Prize Alimentation laureate. A big thank you to the Danone Institute and the French Medical Research Foundation, along with Dr. Prelip, the chair of the DIPA jury, and also the members, Dr. Higgs, Amrani, Jayakumar Henry, Poulain, and Haycraft. And of course, Lordy Scalhouse, who has been so helpful and just kind of mentoring me through this process, and others. And I'm so thankful to be able to have this support from this award for pushing forward our work to improve food security, dietary intake, and health. And furthermore, the collaborative types of research projects that we're pursuing that help to incorporate so many other colleagues in different areas. The award also lifts up the issue of food insecurity at an international level, and I'm very honored to be able to serve as the ambassador in this way for this issue. So thank you again for this great honor as the third DIPA awardee.
Thank you, Heather, so much. That's really lovely. Before we move on to hearing all about your work, I'd just like to introduce formally then two special guests that you mentioned that we have here as well with us today. So that's Dr. Benjamin Provost from the French Medical Research Foundation, the partner of the award. And also, as you mentioned, Dr. Michael Prelip from the University of California, Los Angeles, who was the chair of the jury of the DIPA. And Michael is going to be conducting a Q&A with Heather after her lecture. So I'd just like to quickly say a few words about the Danone Institute International. So DII is an independent, not-for-profit organisation, and our aim is to contribute to the improvement of public health worldwide through the progress of scientific research and education on the links between nutrition, food and health. And the particular focus is on the importance of eating behaviours that are favourable both to the health of humans and to the planet. So we're comprised of a global network of experts from different research areas, spanning nutrition, gastroenterology, as well as psychology and sociology, among many other fields. An important part of our mission is, of course, supporting the DIPA. So as we've heard already, the DIPA is a really unique award because it supports cutting edge, innovative and multidisciplinary scientific research into alimentation that is conducted by a mid-career researcher. So alimentation is the umbrella word for sustainable, healthy eating and drinking practices. And it's a term that recognizes the really diverse influences on people's food choices and eating habits. So this includes economic, social, psychological, and cultural factors. So I'm now going to give the floor to Dr. Benjamin Provost from the French Medical Research Foundation, as I said, the partner of the DIPA Prize. Thank you.
Thank you, Suzanne. First, I would like to congratulate you, either Dr. Eicher-Miller, laureate of this third edition of the DIPA. It's an honor to be here with you today and have this opportunity to listen to your lecture and know more about this incredible research that you and your team are developing. As Suzanne mentioned, the French Medical Research Foundation is a partner of this award since its first edition, and it is our understanding that, in fact, DIPA has been of increasing interest from the scientific community, an evidence demonstrated by the 15 new countries applying since 2017. At the French Medical Research Foundation, we are stimulating and supporting progress capable of improving and saving lives. For this, we operate in the fields of support for medical research and scientific information. And of course, we do hope to continue celebrating science in the coming years with the Danone Institute International through the DIPA. Thank you too for your presences today. And now I give the floor to Michael. Thanks.
Thank you so much. I just want to add my congratulations to Dr. Eicher-Miller. It was such a pleasure to be the chair of the jury for this prize. I really want to thank the rest of the jury members. We had such wonderful discussions and we were so impressed with all of the applicants and we were just so delighted, Dr. Eicher-Miller, that you were one of the people who applied and so delighted that you became the winner. Dr. Eicher-Miller has such a great career so far. She is a full professor at Purdue University, where she earned her bachelor's, master's, and PhD there. I guess you're going to stay at Purdue, would be my prediction there, Dr. Eicher-Miller. And she is also the director of Indiana's Emergency Food Resource Network. Dr. Eicher-Miller is a nutrition epidemiologist, but who is really focused on using her skills and her time to develop evidence-based efforts to try to improve food insecurity in the world. And we are super delighted to hear your presentation. There's going to be a Q&A session afterwards. If you all notice, there's a Q&A function that you could put your questions in there as Dr. Eicher-Miller is presenting or afterwards. And we're really looking forward to not only hearing your presentation, but also having that question and answering period. So I'm so excited for you to be the third laureate for the DIPA Prize. So I'm going to turn it over to you, Dr. Eicher-Miller.
Thank you so much, Dr. Prelip. And again, it's just an honor for me So before I get started with my talk, I think now is the time when we will watch a short video that will introduce, kind of provide an overview of the research that we've been doing. And this will only be a few minutes. And then after that, I will get started on my talk. So I'll let that go now. Nearly 14 million U.S. households face food insecurity, where they struggle to consistently access adequate amounts and quality of food. Food insecurity is linked to inadequate nutrient intake, poor health, and a shortened lifespan. I'm Heather Eicher-Miller, an associate professor of nutrition science at Purdue University in West Lafayette, Indiana, in the United States. I believe that solving food insecurity in the U.S. and around the world is possible, and my research is positioned to do exactly that. My work involves investigating food environments and policies, enhancing interventions, and changing individual behaviors to meet the nutritional needs of diverse groups of people. While 10% of U.S. households face food insecurity, my research team and I focus on the 4% experiencing very low food security, where one or more people in a household do not have enough to eat. We approach food insecurity in several ways. First, we look for marginalized families, such as those who use food pantries and low-income women with children. We learn about their diets, nutritional status, and the places and policies that impact where and how they get food. We then use that information to improve existing programs and to create additional outreach programs where needed. We discovered food insecurity rates as high as 88% among food pantry clients in the Midwestern region of the United States, and that using food pantries more often, having the ability to choose one's own food, and bettering the nutritional value of food pantry offerings has the potential to improve food security and diets. We use this information to create special outreach programs at food pantries and saw food security improve by 10%. Our research has also shown that educating one adult about nutrition can improve food security of an entire household over time. Today's food security issues are complex and nuanced. Families must overcome challenges that often include household income and money management, transportation, time, knowledge of how to prepare foods according to the nutritional needs and preferences of each person in the household, access to kitchen facilities, equipment, and food storage, and the ability to plan ahead. As you can see, food insecurity is a multifaceted problem in need of holistic solutions from many perspectives and disciplines. Our research at Purdue University has been successful in reducing food insecurity thanks to a team of researchers that includes nutritionists, nurses, behaviorists, economists, and engineers, among others. Our work aligns with the Danone Institute's goal to unravel the relationships between alimentation factors and how they impact human health. To garner additional support and resources to combat food insecurity, it is crucial that we broadly share our research findings through engagement and advocacy. Spreading evidence-based findings educates and inspires others to address new questions and spur novel collaborations while also promoting progress. The Danone International Prize for Alimentation will provide us with a new prominent platform for making life-changing advances to enhance food security and health for low-income populations. So now I get the opportunity to share a little bit more about the work that we've done. And so right now I'm going to go ahead and try to share my screen. It says the host disabled participant screen sharing.
Okay, can you try again?
Oh, here we go. Is my screen showing? So the title of our work is Improving Food Security, Diet, and Health. And our research is really targeted to improve overall diet-related chronic disease. And these outcomes like obesity, heart disease, diabetes, and cancer are major killers across the world, as you can see in the maps and darker shading that's shown here. This is not, it's a problem globally, but it's perhaps even more so a problem in the United States, where we have really increasing prevalences of a lot of these outcomes that are shown again in these maps. And we're located in Indiana in the US, which is in the Midwestern region of the US. And so this is the context we're in, and this is where we've really focused a lot of our work. But I do think that a lot of the findings that we've had and what we've designed in our interventions might be things that could be translated to other places in the world. So I think there's some application to other places in the world as well. In the US, chronic diseases like the ones that I've noted here are disproportionately impacting households and individuals with low incomes. And a more kind of specific term for the inability to get enough food because of low income is called food insecurity. And in this situation, households just do not have enough access to healthful food to keep sustaining an active, healthy life. And we have a tool that's been validated and used for quite a while now in the US called the Household Food Security Survey Module, but there are other global tools for this available. But this questionnaire that's people answer the questions on can be used to classify situations that people are living in to one of three main categories. The first is food secure, or also marginal food security. Both of those are considered food secure when people don't have really any barriers to getting enough food for an active, healthy life. When people report actually starting to eat differently because of not enough resources for food, this is called low food security. And this may mean that there's some compromises to the quality of the diet and the variety. Then the worst or most severe level of food security is called very low food security, where someone in the household is not eating enough. So they might be just kind of lessening their intake overall, or maybe skipping a meal or not eating for an entire day. So as you can imagine, these changes, these limits to diet are going to impact health. And food insecurity is indeed linked with poor health, chronic disease, and shorter lifespans. And so food insecurity is an indicator of nutritional risk. And one of the ways that we can measure that or evaluate that is by seeing how diets from households and people who are food insecure compare to our dietary standard that is prescribed or outlined for us in the dietary guidelines for Americans. So this is our evidence-based compilation of what a healthful diet is. And this graphic here in the middle of the slide that shows my plate is a very nice representation of that. We can see that there's certain food groups we need in certain proportions, along with limiting sodium, added sugars, and saturated fats. And then, of course, making sure we get enough fiber and other essential micronutrients. So when we consider that diet to get a score of 100%, and we look at the US diet as a whole, we're not doing well. We already have a diet that's about 60. So then when we put on the constraint of low income and food insecurity, you can see in the green bars in the graph that that diet quality score sinks to the low 50s. So this is indicating that, having this kind of diet in the long term is not going to support longevity and health. Our US rates of food insecurity are right now at about 10%. And the goal that has been maintained over time by the government is to reduce this to 6%. If we look at our rates in the US tracked over time since about the mid-90s in the graph on the right, and we look at this optimistically, we could say, well, actually, this shows some some good things, that we have been able to decrease our rates of food insecurity in the US since the 2008 financial crisis of at least 5% or so. So we're currently again at 10%. We haven't gone below that, but if we could continue that decrease, we would really make our goal and perhaps solve food security. I do want to point out though that we've seen relatively less change among this group who are in situations of very low food security, and that's at about 4%. So this group actually is the group that perhaps could suffer the most. They're in a more dire situation, especially for children who are developing and need certain nutrients at certain developmental stages to maintain their growth and just to get to their full health potential. This need for a proper diet is very important. And so that's why we focus on this group with very low food security in our research. I also want to point out that this problem of food insecurity in the US, as you can see in the graph, it hasn't been solved, and it's been longstanding. It's a difficult problem. So it means that we need to pull in people and expertise that haven't been involved before, that have things to offer to create solutions. We can't just do this from one perspective alone, like nutrition. It's really important that we work together with others. And so that's what we aim to do with our research. And this pie chart here kind of shows you how our work can be divided into three compartments, I guess. So first, we approach things by investigating what the problem is first. So finding out about food security, diet, and health, and then the environment of certain groups that may be hindering those things, or what are good things about the environment that we could build on to better support health and other factors. So first, that investigation is really important. Then we use that information to help us create and improve new interventions, and also evaluate existing interventions and see if they're working. Another third compartment of our research is kind of still developing, and ultimately will support these two other compartments I already mentioned, but it is more focused on discovery and finding patterns in our behaviors that may also be primed for being changed and turned into interventions. And so that will be the last piece that I'll talk about. But now I'll go ahead to describe some of our work in investigating food environments and policies. And I want to say here that it's very important to think about food insecurity as, it is a problem across our population, but there are these certain pockets of people, maybe identified by their characteristics or where they're living, or other factors where food insecurity is much higher. And that's really important to first identify so we know where to target our work. So that's kind of the justification behind our focus in the Midwestern US, and that's also where we're located. You can see Indiana kind of called out in this graphic, and as in the middle kind of the Midwest, but we've experienced spikes in food insecurity over the past several years. Our prevalence in the Midwest has risen and is higher now compared with the US average. And so this gives us more incentive to be evaluating what's going on here. Also, we need to think about the place where we can find this group that is having very low food security. And one of those locations is in food pantries. So that term may not be a term that's used outside of the US, and I'll give you a brief backgrounder of that. So food pantries are private, community-affiliated locations or organizations that collect food from the community or from their constituents, and then provide that food to anyone in the area who needs it. And you can, families can just go to these locations and request food. Usually there's some kind of limit of coming maybe once a month. And they're able to, sometimes just a handout is provided, but sometimes households are allowed to choose the foods that they would like. This kind of organization has been existing in the US for a while, and it used to be used more as an emergency kind of resource. But more and more over the last several years, households are relying on this as part of their normal acquisition of food. So this, this may be because of some changing policies to our federal food assistance landscape. Maybe wages are not keeping up with the prices of food, or other kinds of economic situations are kind of part of the reason behind this. But this is the context that we focused a lot of our work on. And one of the things we found is for those families who are using food pantries, about 40% of their diet is coming from that place. And so it means that it's a very important part of their diet. So one of the studies that we worked on for several years was among Midwestern rural food pantries. And we included 6 states and 24 food pantries from across those states in this work. And there were over around 600 people in our study. And one of the first things we wanted to find out was, what does food insecurity look like among those who use these Midwestern food pantries? We found that there were rates around 80% among this entire group. And then when we drilled down by state, the rates got even higher. So, and the proportion of this was that about 50% had very low food security. So it does indeed show that the very low food secure groups are using these food pantries. And this was in contrast to what estimates we see from our census surveys that show that about 60% of those who use food pantries are food insecure. It's a much greater prevalence than we expected in the Midwest. And so this is just kind of an example of how it's really important to understand and not just accept that what we see nationally is what's going on locally. And every context can be a little different. When we look at diet, we also see that the dietary quality is very low. Again, we quantified diet in comparison to the dietary guidelines for Americans' diet. And you can see that depicted in the graph on the right of the screen here. Among the Midwestern food pantry clients, the dietary quality scores dropped to the low 40s. And again, this is in contrast to the score of about 60 for the US overall. We also saw that meeting nutrient adequacy markers was very poor among this group. And there were a panel of vitamins and minerals where even almost up to 100% of the sample was not meeting those adequacy markers. So finally, when we evaluated health outcomes, we saw that diabetes, high cholesterol, heart disease, and stroke were more than double US estimates among this group of food pantry clients. Some of the other findings that we gleaned from this research were that that food insecurity improved when people were able to have more access to the food pantry, and maybe the food pantries allowed more visits, like not just once a month, but more of an open door kind of policy. Also, diet quality improved when people were allowed to use the pantry more frequently. And then the clients with chronic health conditions really would have liked more choice in what they could acquire from the pantries. And you know, this makes sense when you have limits in the kinds of food you should really eat because of your health. So it's important to provide choice in those situations. And then breakfast skipping behavior was very common among the clients of food pantries and linked with a very high percentage of lower intake of nutrients. Some other things we found out that were positive were that the diet quality that was coming from the food pantries was very high. So when we just looked at those foods that people were consuming from the food pantry, it was high compared with other sources where they were getting food. We also found that food pantries were providing and is serving as a good source of protein, fruits, and vegetables, but there were too many sugary beverages and they needed more dairy and whole grains. So then we could use this information to improve and create new interventions. And I'll give two examples in this kind of component of our research. The first is coming from Indiana and Kentucky that are circled in the map there. Again, two Midwestern states. And for this intervention, we again focused on food pantry clients, but specifically rural veterans, because we had some information that there was high food insecurity among this group. And we also did find that to be true. Diet quality was also low here among these rural veterans. And so the intervention we created was pulling together some of our findings from our assessments. So we wanted to change some of the policies at the food pantry, allow greater access, more visits, welcome these veterans to the food pantry and make them aware of other resources in the community that perhaps they were eligible for, but they weren't using. And so we created monthly outreach events at 10 pantries, and we recruited about 200 veterans for this study. We also introduced some trainings to the food pantry and staff to promote sensitivity to veterans and also food insecurity awareness. And then finally, we introduced nutrition education. That is part of our federal nutrition education program. And I'll talk about that a little bit more in a minute, but what we found from this work, as we looked at food security and use of resources before and after this intervention, which was about 6 months, and we found improvements in food security by about 10% greater odds of food security and use of resources by 11% after the intervention. So it kind of shows that you can, like making people more aware of the resources that they could use, maybe food assistance or other veteran services and food pantry offerings as well can help improve these outcomes. So the next study I wanted to share was one where we specifically focused on this nutrition education component. And just to give you a little backgrounder about this, in the US, our main type of food assistance is called SNAP. And this food assistance is providing a food benefit or food voucher for low-income households that have less than 130% of our poverty line. This program is extensively evaluated and shown to improve food security. So it's pretty effective. But there's a kind of wing or other side of food assistance that is directed, that it provides education. And so this is called SNAP Ed. This is provided totally independently from food assistance, and it focuses on giving education to maximize food dollars in low-income households. The gap is it has received very little scientific evaluation. So there really wasn't good evidence about how effective this program was. So we wanted to determine this. And we've carried out a series of 3 randomized controlled trials that have focused on nutrition education. In one of our first trials, we randomized participants to a group that would serve as a control and not get education until after our study was over, which was 1 year later. And then the intervention group got the nutrition education. When we evaluated this, both groups for food security, we found that household food insecurity among the group that got the nutrition education decreased by about 25% from 1 year later compared with baseline. And this increase was regardless, in some of our follow-up studies, by other factors, like whether or not they were using food assistance, the location of their household, many of the different programmatic factors, and other kind of community contexts. So it shows that nutrition education is perhaps underutilized in the US, and it could really be a bigger part of a solution. It is a much smaller program and reach compared with food assistance in the US. So we're following up on this to carry out another randomized controlled now that's focusing on diet and evaluating this among adults and kids in households. So the implications of all of this work, this intervention work, is that the emergency food system and food pantries have a really high potential to reach this very low food secure group. They're scattered in small towns and communities throughout the US. So they have this existing infrastructure and link with other resources in the community that could be capitalized on and built from to connect this more local solution to food insecurity to more national solutions like food assistance. And those links may be being underutilized. So that's something that we could do to try to connect these systems together to improve food security. Also, nutrition education, it could be expanded in the US. And we found it, very surprising and amazing that nutrition education, it doesn't provide extra food dollars or extra food. It's education that once you receive, you don't lose it. You can use it forever. And it was able to have this impact in food security even 1 year after the program was over. So this is something also to try to build on for future solutions. So this brings me to the very last side of my research to share today, and that is this discovery of dietary patterns that can be used to change individual behaviors, hopefully in the future. So this work is possible through a really strong collaboration with our engineering partners here at Purdue. And one of the things, we wondered about in beginning this work was like, the aspect of timing of our behaviors is not really incorporated much into our knowledge of health. So we know that, totals of diet quality and activity are linked with obesity and other health outcomes, but we don't know much about the timing. If the timing of those behaviors matters, like when we eat, when we sleep, when we're active. But this is a reality, like that's the way that we live every day. And we practice all these things in a time sequence. And so we wanted to work on discovering what kinds of patterns existed in the US, and then are these patterns important to health? So we were very fortunate to have our US National Nutrition Monitoring System to draw data from, the NHANES, that had dietary data and then also accelerometry data and health information that we could use in this project. And one of the first things we did is look at both diet and activity over a 24-hour day. And you can see 4 examples of participants and their diet, which is shown in blue, and activity shown in red. Their patterns on a 24-hour time scale. So that's on the x-axis, going from time 0 to midnight from the day before to midnight of the current day. And then the y-axis is kind of the amount of each of those things. So the energy that's consumed for diet and the intensity of activity that's shown in red. And so you can see each person has their unique pattern, and we developed some machine learning methods to be able to find out how closely related the patterns were to each other. So we did this by finding the differences between each of the similar events for each person, and then comparing those between the differences in the events of every other person in the sample. So it was a lot of differences, millions and millions of differences. When we add those differences up and minimize them, it shows us people whose patterns are similar. So you can see a depiction of that in the bottom graphic, where we have person 1 and 3 have a distance of 0.19. That's much smaller than person 1 and 2, who have a difference of 0.6. So we would expect then that person 1 and 3 would end up in a same kind of pattern. They would be grouped together. So we found the main patterns that emerged from this data in our sample. And there were 4 main patterns that are shown on the left. And then we looked at the relationship of each of these clusters of people to a whole panel of different health indicators. Some of them were more short-term and some more long-term. And these 4 graphs here show you the visualization of those patterns. So pattern 1 in green and pattern 3 have more of an pattern 2 in yellow have more of an evening oriented pattern where they're consuming more of their energy. A bigger portion of that group is consuming more of their energy in the later hours of the day. That's in contrast to pattern 3 in blue, where there's more of a noon kind of, or earlier in the day kind of intake of the most energy. And then pattern red is very moderate. So you can see throughout the day, they're consuming similar amounts of energy. This red pattern was the one that was linked to the lowest BMI and the smallest waist circumference and the lowest prevalence of obesity. And then when we looked at activity in the same way, we found that the 2 patterns that had highest intensity activity, whether it was earlier in the day or later in the day, as shown in those red bars and the 2 graphs with the stars, it didn't seem to matter. They were both strongly linked with lower BMI, smaller waist circumference, and lower prevalence of obesity. So in conclusion, then, it seems that eating a moderate intake of energy throughout the day with high intensity activity, either in the morning or evening, is linked to better health. And furthermore, it's possible to integrate these multiple behaviors into patterns and then find out their linkage to health. If we want these to be important, we need to follow up with randomized controlled trials to see if they're causal. Like, do these patterns cause these outcomes. We don't know that yet. We've only shown a linkage. So we need to follow up with those kind of studies. And then this information could be very useful in the future, because we're collecting a lot of this kind of data already through our smartphones. People monitor their steps per day, their heart rates. All this data could be utilized to give us real information in real time about our patterns. And if they are causal, we could give people feedback to try to help them improve those patterns or monitor those. So this brings me to the very end of my talk. And just to kind of wrap things up, we want to continue this work to focus on solutions to health. We can build on our interventions through the emergency food system and nutrition education as important focuses for the future, and then keep going on this work to unravel how patterns of daily behavior impact health and may lead to more effective interventions in chronic diseases. Thank you very much, and I'm really happy to chat with you now and answer questions.
Thank you so much, Laureate Eicher-Miller, for that presentation. I learned so much, and as the chair of the jury, I'm going to take my prerogative and ask the first question. But before I do that, I just want to really thank you, because when we think about 10% of the U.S. population being food insecure, we're talking about 35 million people, and which is huge. And thinking about that national objective to get down to 6%, we'd still have like 20 million food insecure people in the U.S. So my question for you is kind of thinking it from a social movement perspective. One thing that happened during COVID in the U.S., people saw the really long lines at food pantries. And I think it became more on the collective conscience of Americans to see that this really is a problem in the United States. And I'm wondering what you think about how that may have impacted people who aren't food insecure and thinking about this as being a collective problem rather than looking at it more from an individual problem, and how perhaps we could harness that, or have we harnessed it?
Yeah, I think that's an excellent point, and I think that's probably true that unfortunately during COVID, food insecurity may have reached out beyond its traditional borders of what families were impacted, and reaching into families that had higher incomes and those that really hadn't experienced food insecurity, and also shining this national spotlight on the, as you mentioned, the use of the emergency food system during that time. I hope that it's brought it out into the public awareness more. But one of the interesting things I think we've seen emerge too from the data that's monitored food security during this time is that we did see food insecure estimates shift around a lot during those years of COVID, but the overall national estimates really held constant. And I think that's a tribute to our expansion of food assistance during that time, and expansion of the school lunch and the efforts to provide that out to kids even not physically going to school, the expansion of food assistance and the supplemental support that households were getting during that time. It seemed to be effective, looking at how our national food security stayed the same. So I think, COVID was we could learn a lot. It was a bad time, but we can learn a lot from what happened then to help us improve things in the future.
Thank you so much. I want to remind everyone, if you have a question, please put it in the Q&A. We've also received some questions beforehand, and I'm going to read one of those right now. Professor Eicher-Miller, what are the most promising ways you see for the food and beverage industry to be brought into efforts to improve food and nutrition security?
Yeah, this is a great question. And I do think that the efforts that the food and beverage industry can take to support health in the products they're making, that is going to raise all ships. Because as I showed in my talk, the dietary intake and quality of the US population is poor already. It's not like food insecurity and those diet issues are just a problem for low-income households. The diet quality issue is a problem for all of us. And I think if the food industry can be conscious and try to try to provide economical products that also promote health, like lower sodium formulations, lower sugar formulations, lower saturated fat, all those things that can help support improvements for all of us and also among low-income households as well.
Great, thank you. We have a question in the Q&A. It says, fantastic presentation and congratulations on your work. How are you going to implement the nutrition education to reach so many people? And I think that's always a huge question about scalability and to actually have a greater reach and impact.
Yeah, that's something that we continue to think about. One of the things we'd like to address in the future is trying to learn more about the group that's eligible for the nutrition education program that's not using it. And also that gap in people who are not using food assistance as well. Because we know both of these things are effective. Both of these programs are effective. And it's really unfortunate that we can't connect more people to use them. So, and unfortunately, it kind of tends to be a lot of the groups that are already marginalized who have the biggest gaps in their eligibility and their use. And so we'd like to kind of learn what some of those barriers are that, is it because nutrition education is not present or they're not aware of it? What are some of the reasons that households are not connecting with it? And also similarly for food assistance. So I think also kind of spreading the word that it is effective, that nutrition education can make so much of a difference. And I mentioned our follow-up study to evaluate diet quality. We'd like to really see if that's being improved by the program. And if not, why is that? Maybe it's just because of the food insecure context. People, if you're still food insecure, you can't really worry about nutrition when you're just worried about getting enough food. So then that kind of speaks to like more food assistance would be helpful, because a lot of low-income households are working. It's just that they're not making enough money.
In thinking about the diet quality and thinking about one's food environment, if one is dependent on food pantry, and the quality of the food in the food pantry isn't ideal or could be better, which I think it varies across the US and probably across the world, what is available, and kind of limiting people's choices, even if they had the nutrition education and wanted to make those choices. What are your thoughts about kind of the food pantry environment in the world or in the United States for assisting in improving diet quality?
Yeah, that's a great point. And I think too, it's really important for us to not just think of diet quality as all personal choice. It's a lot about the environment and the what we have access to and what we're supported with as we go about our daily routines. So the environment of the food pantry is really important for, as I mentioned, about 40%, and that could vary a lot too, of intake for people that use food pantries is coming from the food pantry. So it's a big major source for them. And yeah, we actually found that the diet quality from the food pantry was pretty good, but as you mentioned, that could vary. Some of the food pantries that we're aware of in Indiana are literally pantries, like they're a cabinet with like 2 shelves. So you can't provide a high diet quality when there's just not that much food there. So I think, you know, that kind of means that it's important to educate directors of food pantries on maintaining a high quality variety of foods, and trying to support like fresh offerings, fruits and vegetables, and dairy and other kinds of foods that households, that some perhaps also foods that people might perceive as more expensive, but that people can still have access to at food pantries. But it also, our research also shows us that, like, how can we work more on environment and the other kinds of foods that people are getting from the grocery stores and convenience stores and other locations. We want those offerings to be more healthful as well. So yeah, we don't have all the answers, but we're trying to figure them out.
Yeah. Well, thank you so much. I did get a notice my internet, of course, has become unstable. So if you lose me, I apologize. But I'm thankful it's lasted to this point. You know, we received a number of questions that we're not going to have time to get to, but the answers will be on the website. Professor Eicher-Miller is going to answer them. So for anybody who submitted a question before, take a look on the website and you can see her thoughts on this. Well, you know, I'm going to have to call you just because I have a lot more questions and I want to continue this. And I just, before I pass it on, really want to thank you once again for your presentation. And I'm just so excited for your work. And again, congratulations. And I'm going to turn it back over to you and to Professor Higgs.
Thank you, Michael, for chairing that Q&A session, which was fantastic. And yes, as Michael says, we have loads more questions, really fantastic ones. So do go and visit the website to look at those. So yes, unfortunately, we have run out of time. So it just remains for me to say congratulations once again to you, Heather, for the award, and wishing you the best of luck with your research on this topic, which is, you know, so important and clearly very timely right now. So thank you again, and thank you to everybody involved in supporting the DIPA Prize, including the selection jury, and as well as the final judging committee, everybody involved in supporting and organising both the selection and also this wonderful event today that's been so enjoyable. And thank you all for attending and contributing, and I wish you all a very good rest of the day. Thank you.
Thank you so much.
Congrats again.